much.
Hi everyone, thank you all for being present at these keynote presentations at TUFH 2021. My name is Camila. I'm a medical doctor from Indonesia, and I will be moderating these keynote sessions with Nurul, Hanifa, and also Bionda from UGM, and also Andrew for UGM Indonesia. Our keynote speaker is also my friend, Yassein Elhussein, at 23 years old, fresh graduate from University of Jazeera, Sudan. He is the outgoing president of the Student Network Organization, or SNO, a self-motivated youth seeking opportunities to develop skills, achieve intellectual and professional growth while being resourceful and innovative. He is a social advocate, community activist, change maker, and innovative leader with great experience and high organization skills. He has acquired a broad range of skills while establishing, working and leading many NGOs, voluntary works, student associations, initiative and help projects locally, nationally, and even internationally. He has been recognized as a youth leader from United Nations Development Program or UNDP Sudan. Moreover, he is internationally certified soft skills trainer and also a human rights trainer from EFMSA. He has trained and empowered thousands of students. Also, he is a follower of TIFF since 2015, participated at the World Summit on Social Accountability in 2017, winner of the SNO GEMX International Student Exchange Program 2018 in Ireland, where he also got elected as Vice President of SNO. In 2019, he was elected as the SNO International President, demonstrating exemplary leadership in SNO team. He adding great value to the organization and made significant and lasting contribution to SNO until now. Well, he represented SNO at the 73rd World Health Assembly of WHO. Recently, he was enrolled as a policy fellow in the 2020 fellowship program on social accountability and accreditation. Well, yeah, he is indeed a real model for the youth and a huge inspiration for the SNO Intuf community. He is an advocate for human rights and passionate about health research, public health, and medical educations. I hereby invite you all now to listen to his presentation on what students can do for mobilizing community and engaging stakeholders for the health. You can ask your question and or provide your comments in the chat functions below. And also please note your name and country in the chat before asking your questions. Yasin, are you ready?
Yeah, of course.
Okay, the floor is yours, Yasin. You may start.
Okay. Um, Hi everyone, and good morning or good evening or good afternoon according to your time zone. Thanks, Camila, for introducing me. And happy Eid Adha for all Muslims all around the world. And I'm very happy to be speaking to all of you today and presenting my keynote speech. So let's just start. And I would like to start first by asking all of you to close your eyes for a couple of minutes and get some Megan with me. I know it's early morning or even midnight for some of you, but please don't fall asleep. So let's now imagine yourself living in a very remote village. The total population of 4,000 and more than 200 families located at an agricultural area 120 kilometers far away from your nearby city of your state. It's a fall season, which rains and floods cover everything. Roads are rough and impassable. Transportation is so difficult and kind of impossible. Insects and mosquitoes everywhere, and high incidence of communicable diseases, poor environmental health, absence of health services and medical care, social problems and disagreements with your nearby village. And not only this, guess what? Imagine your wife is pregnant and today is her day of delivery. But because there is only one midwife, and to be specific, only one old age traditional and non-trained midwife at the village. And for some reason, she was busy that day and unavailable. So you need to take your wife to the nearest health facility, which is 45 minutes away from home by car. But due to the rains and unpassable roads, you took her riding on a donkey cart to pass through. She's screaming out and in pain, and delivery is almost inevitable. So you ended up by prolonged labor, and the baby died just before you arrived to the health facility. But you saved the mother. And then by incidents, you discover that she has uncontrolled hypertension. So you started to blame yourself, blame the road, the life, and even blaming the donkey because you don't know who's responsible and why all of this happening. Now, imagine that you were lucky and you succeeded to save both the mother and the baby, but the primary healthcare services are not delivered efficiently. There is no immunization unit. Vaccination is done through regular campaigns only. Your child got sick. You didn't have enough money to seek medical specialist advice at the hospital, so you ended up digging your own son's grave and buried him with your hands and started to blame yourself again and again and again. Now open up your eyes and let me see how do you feel. I think some of you may get emotionally connected to this story, and even some of you may cry while listening to this story. But the thing that you don't know is this is not just an imaginary story. It's a real and true story which happened in a remote village and rural areas in an agricultural area in Jazeera Eastern locality in Sudan during fall season where rains and floods cover everything. Rough roads, unpassable transportation is so difficult. Fools, insects, mosquitoes are everywhere. Pregnant lady, one old age midwife carrying her on a donkey, no immunization unit and no health center and no primary healthcare services provided at the village. So your child got sick and then you buried him with your own hands. The story I'm going to tell you today is really important and deserves to be shared in tough community. Today you're going to leave with an exciting and inspiring model for community mobilization and stakeholders engagement. If you follow this, not only you will be inspired, but also will be capacitated and enriched with knowledge and tactics to do a real change at your community and to create a major impact and save many lives, especially in developing countries. So by the end of this speech, you will come to realize how students should be recognized as important change makers and advocates for better health well-being. You will be amazed by the effort done by the students, by their great leadership, and how can they serve as the human resources for health and facilitate dynamic communication strategies to educate and empower both students and community members for local and national health initiatives. Now let's get dive into the journey. So 5 years ago, when I was a second year medical student at our lovely Faculty of Medicine University of Ujizia, FUGM, I was a leader of 22 group of medical industry students, and during a course of interdisciplinary field training research and rural development program, which is interprofessional, composed of 3 phases, um, ended up by conducting a health project to the community and conducting a community-based research being submitted to the Department of the Community Medicine at the faculty. So basically, it's 3 phases. We've sent to a rural area in Jazeera Esir locality, aims to study that village in the first phase, then to implement and to conduct a health project in the second phase, and the third phase was the evaluation phase. So I'm going to tell you about the journey in this village and how did we achieve a lot of things. The phase one, as I said, is for team building, writing proposal, fundraising, doing logistics, implementing program, and then these were the pre-departure preparation that we've done. We devised the task and leadership roles ourselves. We formed a lot of committees to facilitate the activities, the engagement with the community. We had general administration committee, financial, logistic, partnership, collaboration, communication, scientific, environmental, social, and site program. This was the pre-departure preparation for the first phase, and it was 7 days of placement at the rural area. And this was on the departure day. So before we head to the village, we did also general preparations as we send exploratory delegation from ourselves, administrative committee. It aims to meet with the community leaders doing initial mapping, community mapping, and potential stakeholder listing to identify also social determinant of health at the village, historical background, gather demographic and geographical data, and to discuss also the course objectives and timeline of the activities of that week. Also, we collaborated with all of the community members to allocate the logistic materials and resources needed for the daily activity for that week. It also was preparation for the students' accommodation during the placement. So the arrival day, we mainly focused on team building with the community leaders and community organizations, doing meet and greet meetings, building trust with them, giving them general overview of the program, advertising our 1 week of healthy week at the village, and then we prepare for the second day activity. This is the timeline and agenda for the program at the week at the village, which composed from arrival day, data collection for 2 days, health education, environmental health day, therapeutic day, which was free, then social, closing, and departure. The methodology that we've used as a group, we did daily meetings to summarize and report and prepare for the next day's activities. And this strategy is one of our during one of our group meetings. So stakeholders were involved in this whole process, and all projects included but not limited to Faculty of Medicine, University of Jazeera, FMUG, of course, Ministry of Health in Jazeera State, Health Services Administration in Jazeera Esser locality, local committee of citizens at the village, youth union, women union, administrations of schools at the village, Sudanese Red Crescent Society, safety motherhood and childhood initiatives, and charitable associations as well were being involved. So summarize what we've done in that phase one and that week. Day 2 and 3, they were just for data collection and doing interviews and on filling out questionnaires to study the health problems and all of the community things. The 4th day was for health education programs where we enriched them with knowledge about a lot of important topics. So the 5th day was the environmental holiday where we conducted a campaign to clean all of the village with the help of the community members as well as the school pupils that were a vacation day for them. So we cleaned the village. And the 6th day was the therapeutic day, and it was composed of free medical clinic, also free laboratory investigations, and we provide some medications. It also was a method for having an overview about the incidence of some of the diseases to get how to intervene. And it's also include dental clinic. This is the dental clinic. The 7th and the last day was a social and closing day where we some social programs. We played a football match and we won the cup. And then the evening was a closing and appreciation from the community leaders and ourselves as well. So this was the first phase. It was for 7 days. And by the end of the first phase, we identified common population problems according to the data that we've collected. And then we classified them into categories being health, environmental, and services. So prioritizing the problems according to the scoring system then, and capacitating the community leaders and the stakeholder then in project management and evaluation. And we did stakeholders mapping. We agreed on a specific proposal for the project that we will intervene with. And we formed shared committees between us and the community leaders for follow up for those projects. And also the main thing that we focus is building trust with the community so that we can move a step forward with them quickly. So what we found, this table summarizes the major problems that we've discovered at our statement. So we found a lot of problems, as obviously were highlighted in my story that I've mentioned during my speech, but we found infrastructure problem, services problem, health education problems, and health workforce problems, ranging from high incidence of diseases, no health center, no high school, difficult transportation, poor hygiene at the market, and so on. And you will get to know them better by the end of this presentation. So Phase two was the implementation phase, and I would like to share what we've achieved during that phase. Our title of the project was Health Promotion and Combat Endemic Diseases in the Pressure Village, and it's a real model for community mobilization and engagement of stakeholders. The general goal of the project is health promotion and combat endemic diseases, decrease the morbidity and mortality rates, and providing primary healthcare services. So this project was designed in an integrated approach, and the main integrated components were establishing a health center from the scratch. There was no health center there, no primary healthcare services. So we collaborated with the Ministry of Health and the local health administration at the locality and the community leaders as well to get the approval of building a health center and from the scratch and getting the authorization. So sustainability was assured by registration of the health center in the Ministry of Health. A committee was formed composed of the community leaders, including committee of citizens and all of the other community leaders for following up the progress in building the center and regular assessment, as well as appointment of the health staff and strive to provide them with housing in the village to contribute to their stability. This is the picture for health center. Sorry. And the second component was establishment of a healthy market. And it's obviously clear from this photo that the vegetables and fruits are exposed to the ground to be sold around with the stagnant water and dirty. So due to that, we've come with a proposal of establishing a healthy market with this design. So we designed this project and then we implemented it as you see on this picture to help to decrease the contamination to the fruits. And so the land has been authorized and registered with the local citizen committee, as well as the formation of a committee have been also done for supervising the market, collecting monthly subscriptions from the sellers, which represent a source for fixed income and contributes to the development of the market itself by increasing sales places and supply the people with special needs and patients in chronic diseases. The third component was massive health education program, where, as I said, we provide them with rich knowledge about a lot of common health problems, communicable diseases, non-communicable diseases, endemic diseases at the area, as well as bad and traditional beliefs and habits. And sustainability will be taken as the health center works. The medical staff will give health education as a part of their job description, and also we encourage the community active leaders to organize and conduct such also campaigns. The fourth component was foundation of a simple active and permanent waste disposal system, which were mainly focusing on cleaning the village because it has very narrow road in which very difficult for a big vehicle to do all of the cleaning process. So and also as we observed during our environmental day that something should be done. So we come up with this solution by founding a simple active and permanent waste disposal system and using a donkey cart to collect those rubbish from outside the houses and then burn them outside, or even another vehicle would come to take them. So sustainability was also taken by providing a donkey cart and employment of a worker from the village to take care of the donkey, collecting the waste 2 times per week and burn it outside the village. He had been authorized also to use the donkey cart for his own benefit and the rest of the vehicle. So he also takes some few amount of money every week from every house as a salary. And also committee has been formed to follow up on the progress of the project. The fifth component was planting 400 fruitful and 20 shady trees, as we also noticed during our environmental day that there's lack of trees in the village. So we collaborated with the Minister of Agriculture to provide those plantings, and a committee was formed also to follow up with the growth of the trees, watering, as well agreed with an agricultural expert from the Department of Agriculture in the locality to give them instructions and guidance on how can they deal and with the trees. And also in the future, a specific land allocated as an agricultural garden to plant fruitful trees and the return and the income to support the development of the project at the village and the needy patients as well. This was one of the photos. The sixth component was training volunteers on first aid. While we also found there's no anyone trained on first aid and in emergency situations, so we collaborated with the Sudanese Red Crescent Society to provide toolboxes and materials for first aid, and as well to conduct a training program for 20 people from the village and to capacitate and enrich them with the skills for in first aid in situation. And the most vulnerable groups were the school students. So we conducted this training to school teachers and as well as the football players in the stadium. And sustainability was taken part into consideration, and it was agreed that they would teach others from time to time to maintain sustainability. Seventh component was the periodic follow-up of hypertensive patients, while we found a high incidence of hypertension at the village. So we come up with the proposal and deal also to absence of any healthcare provider or any primary healthcare center. We come up with providing them with two electronic measurement blood pressure measurement devices, and a committee was formed and trained them on how to use them and also give sufficient knowledge of hypertension in terms of symptom signs, complications. So the committee was responsible of listing hypertensive patient and allocating 1 day from the week for the follow-up and measurement, and also writing this measurement and record them in a booklet so that will be taken by the patient while referring from a health facility to another. The eighth component was fighting malaria because it was an agricultural area, so malaria is very common there at the village, and it was high incidence and mortality rates as well. So we come to with the collaboration with the local health administration at the locality. We provide them with the sprayers, and we teach them how to spray, how to prepare the solution, the pesticide, and the malaria technician as well, giving some instructions on safety measure and how can they do all of this stuff. The ninth component was midwifery training, where we collaborated with the Safety Motherhood and Childhood Initiative at the Jazeera State. They agreed to allocate some scholarship for young ladies and young women from the village to be trained as being midwife. The 10th and the last component was doing that community-based research as a scientific study and submit the final report to the Department of the Community Medicine at our faculty. So what is innovation there and what is the creativity? As you heard that they said, give a man a fish and you feed him for a day, but teach a man to fish and you feed him for a lifetime. So we follow this. We teach them how to fish. We empower them so that they can solve their problems by their own. So this project represents a real model for community empowerment, as we let the community initiative through their full participation in all stages of thinking, planning, implementation, management, and evaluation of the project, and encourage them to develop their health system by themselves at the cost that they can afford to maintain the development at every stage and in the spirit of the self-reliance and self-determination. So the key principles that we've used is to let go our own ideas and to don't control them, respect their rights, respect their abilities, respect their experiences, and also believing in their abilities. Treat them equally, hear all of their voices. We were very flexible in the project design. We work with groups. We form a lot of committees, shared committees between all of the stakeholders. We'll listen to them, building trust and rapport with them. Then we process with learning, teaching, capacitating, and doing real change and impact. So equality, empowerment, and even ownership, group cohesion, and then identifying opportunity for them for development. So the first thing that we've did is to investigate and explore similar case studies and common problems and examples of new approaches and solutions. Then we come with innovation ideas. We use all of the information that we've gained today to formulate new solutions and then to implement continuous monitoring, reflection, and adjustment. And also to evaluate the success to continuously build the knowledge base and plan to engage widely with the community as an inclusion, and also introspection by arrive at the stakeholders' common moral purposes. So I'm very proud to say that we've succeeded to move them a step forward and step up the ladder of engagement and community empowerment, from being informed to being listened to being involved, and even get the sense of ownership to those projects. And it's well said that a pearl is beautiful, but alone it doesn't make a necklace. It's the thread which makes the necklace. And I'm very proud to say that we succeeded to make this thread, to connect our pearls, to come up with a very beautiful necklace. And it's clearly and obviously explained and showed in this picture. While you can say we can see all of the community members, all of the aid groups contributing in building and establishing that market, building, doing hand stuff. Even the women were just doing some homework and provide food for them. Even the children that are sitting on the ground and just focusing on what's doing and getting the sense of ownership and volunteerism. So this is was so amazing while we doing this. So in identifying stakeholders, we basically use the matrix, the stakeholder matrix, power interest grid, to classify them and to categorize them according to their power and interest into high, low, those whom with high both power and interest. We manage them closely and get them involved to the loop as stakeholders. And then also the others, we keep them informed, monitor them, keep satisfied, and move them from one block to another. So this project, characterized by multi-sector and authorities, it was achieved through applying the primary healthcare concept in community leading initiatives and community empowerment, the implementation based on a prioritization of problems through scoring system, which includes importance, danger, urgency, community concern, solvability, sustainability, and even the cost. Project sustainability was greatly considered in all components and interventions. Projects were carried out via strong leadership from all parties. The project was implemented in a clear methodology and strategic plans. The society has been mobilized and even empowered. It pointed that health promotion and disease prevention has a role in socio-economic development, so it solved the village basic problems. Phase 3 was the evaluation phase, where we did evaluate all of our interventions and all of our work. So we use different methods of evaluation to measure the impact. We compared between the data that we've collected before and after the interventions. We designed a questionnaire aimed to directly assess the project success. And it was filled by the community leaders as well as the population. And also we've used the therapeutic days reports and observational checklists to evaluate our projects. So that's all for the program. And it was ended by 2018, I'd say. But then what next? We achieved all of these great projects, but then what next? That was the question. That was the question. But I'm very proud to say that they got empowered to take their own lead. And in this picture, you can see that gentleman on the middle of us on the green shirt. He was one of the young leadership of the youth union in 2016, and today he is the president and the leader of the local committee of citizens at the village as a whole. So that's how they got empowered. And not only this, they are now starting to establish their own community-led projects. Why you can see this is the newly advanced with well-equipped health center with the nice looking, you can see. Not only, but they also succeeded to build and establish a mosque for them for doing their prayers from the scratch with no help or anything from others. They have also built two newly rooms for being a place to provide some religious classes and to help the children to memorize the Holy Quran by the Sheikh. They've also established two new water sources to the village. Not only this, but they have now also established a high school at the village. And now they are proposing a project for tailoring for the people in need to help them to raise their income by producing some dresses and products and to sell them. So this is also a current ongoing proposal project. Okay, that's all. But as a take-home message, social determinants of health are significant drivers for healthcare costs and quality variation, as well as health inequities. States and local communities are experimenting with broader approaches to achieving uniformly high health outcomes. Real progress on improving health outcomes and health system efficiency requires collaboration across community stakeholders to ensure that incentives are aligned and the actions of different actors mutually reinforce the community health goals. Community mobilization and multi-stakeholders engagement are key approaches for improving population health by surfacing population needs and aligning a broad range of stakeholders to address those needs, which leads to improving health equity and realizing better healthcare value. The role of health health science students should be recognized as an indispensable health educator and change maker in community-based health promotion projects. Therefore, the future integration of early practical community experiences throughout the health professions education by strengthening academic training of medical students in public health, as well as providing them with a specialized toolkit to use when leading local and national health initiatives. So that how they got empowered. But I would like to share finally how it got empowered. In 2016, this photo was taken
I'm
during
sorry, Yasin, the time
orientation.
is up.
Okay, it's just 30 seconds maybe. Um, this photo was taken during an orientation session of TUFH and SNO, where I've just get to know TUFH in 2016, and I've just raised my hand that I would like to participate in the conference with no idea about conducting research or leading a project. But then I have participated in 2017 conference at the Tunisia. Then I participated in TUFH 2018 conference at Ireland. I got elected as vice president, and then in 2019 visited Australia and elected as a president of the Student Network Organization. And I'm very proud to say that I'm 22 years old and being the youngest person on the top board of directors. And it was a very lovely journey. This final picture, 4 years ago, when I took this picture at the end of the keynote speech on the stage during the World Summit on Social Accountability at TUFH 2017 conference, little did I know that time that opportunity given to me should spark such drive and motivation for me for reaching this point, the privilege of presenting my keynote speech at TUF 21 conference. Thank you for your attention. Hope you enjoyed my speech. I'm very happy to answer your question. Thank you so much.
Wow, 90 slides, and I was very mesmerized. I wasn't even blinking, Yasin. And that face and pro analogy are just amazing. Thank you, Yasin, for such an emotional but also encouraging and insightful presentation. Please, ladies and gentlemen, give him a big round of applause. Yay! Now, I guess we're opening the Q&A sessions. Yasin, could you please stop the start screen? Okay. We're opening the Q and question and answer question. Should you have any questions, please ask in the chat function. Also, please note your name and country in the chat before asking your question. You can find the chat function on the toolbar. Okay. Mm, I didn't see any questions coming, so I'll just have several questions for you, Yasin. You presented that there were several phases that you and your team done. Well, in fact, these phases can be applied universally and generally in doing community empowerment in all over the world, both for community mobilization and also the stakeholder engagement. So, Yasin, which phase do you think is the most challenging and why?
Thanks for the question. So which phase is most challenging? I think it's the second phase, which is implementation phase. Uh, I think even each one of those phases has its own challenge, but due to the different contexts all around the world, I would say that the second phase was the most challenging as limited resources, developing country, a lot of problems in the administrative work. So that was so challenging for us, but we succeeded to do all of those collaboration and end up by intervening. Thanks.
Yeah, that's actually a good answer, Yasin. Thank you. There's an incoming questions from Kamayani India. She asked, hypertension, did you observe any other mental health issues besides hypertension? Were there any specific women's health issues you observed?
No mental health issue that we've observed, but regarding the women problems, I think that uh, some traditional habits that the early marriage for girls, that was one of things that we've noticed, and then we conducted health education about that, and they're also using a lot of steroid materials for skin whitening.
Okay, I think that's just answered the questions. Next question from Sivan, India. Yasin, did you convert this into a report or reports by groups of students in each of specific aspects?
Yes, a final report of the project and all of the phases have been submitted to the department.
Okay. From Robin, Australia. Thank you, since I met you in Tunisia and also in Australia. I think it's from the 2019. It's great to see you. Another question from Yakubu, Australia. Keen on knowing more about how the community mobilized resources to meet their own needs. How did they sustain this? He asked about the sustainability, I guess.
Okay, sustainability was a major factor that we've considered during our establishment, and sustainability was taken into consideration by forming a lot of committees for following up all of the execution of those projects, and for sustaining the partnership and collaboration. And sustainability was also made by empowering them, and enriching them with the skills. When you teach them the skill, you don't need to go again and teach them the same skill. You just need to follow up with them. So yeah, that's how we maintain sustainability, also by maintaining collaboration, partnership, by maintaining the capacity building for them. And you clearly see that in the project.
Okay, Yasin. Yakubu, do you want to respond, Yasin? You can just respond him by turning on your microphone. Okay, next question from Eugenie
Yeah,
Emmanuel.
sorry if
Okay,
I could just respond.
okay, Yakubu,
Uh,
go on.
Thank you so much, Yasin. I mean, brilliant presentation. And just to follow up on the parts about mobilizing resources without external help, I'm sort of curious, or rather interested in knowing more, learning from you in that regard.
Um, so for mobilizing the resources, we've started during the study phase of the project and writing the project proposal. We have a specific list of needs. So we come up and do mapping for those needs and how can we get those resources and from where. And we built like a local network for seeing who can collaborate with us, who can contribute with us from the community leaders themselves, from the community population, from those whom belonging to the community but outside the country of Sudan, from those stakeholders we will be inviting. So we basically coming up with a final list of all of the resources that we need, and then a potential list for sponsors and fundraisers to help with that.
Okay, Yakubu. Moving to the next questions is from Eugenie Emmanuel from Uganda. Is that initiative still at your university, Yasin?
Actually, it's not initiative. It's a real course within the curriculum of the Faculty of Medicine at FMUG, as known as Interdisciplinary Field Training, Research, and Rural Development Program, and it's still happening and going on. So yeah.
All right. I think there isn't any left questions, but I want to ask for the last questions. You've shared to us the picture diagram for identifying stakeholder engagement. Is there any process you do to analyze which stakeholder that you want to engage?
Yeah, the process is as I mentioned, but I didn't really get into it because of the time. Was doing that mapping through the matrix, the grid of the power and interest, while we come up with a list and then putting them accordingly according to the power. Who is having the creator? This stakeholder who have a leadership role, have money, have resources to support, and have all of the three M materials: manpower, money, or yeah, to help us. And those who have interests, those who like within the same line with us in community empowerment, or with health administrations, in NGOs related to one of those problems that we've mentioned. So those have interests, but they might have the power or they don't. So by classifying them, then we come up with who we can go and ask for help by power, because they have already the interest. But the others, if they don't have the power but they have the interest, we keep them informed. Like, yeah, you can be with us still. Your this is what you're doing. You will be doing, and so on. And then when they get the power or the money, they will sponsor or be a part of our closely engaged stakeholders. And those who don't have the interest, but they have the power, we struggling and striving to make them being interested and encourage them to actively participate with us for it. So that's how we manipulate all of those 4 blocks.
Wow, you just answered my questions. Thank you, Yassein. Well, I think it's the end of these sessions. Thank you. I think we are all really enjoying your sessions, Yassein. I would like to express my appreciation to all the participants for taking time to attend this conference. Remember to take the home message from Yassein, and I would like to close my remarks by quoting Helen Keller quotes. It's alone we can do so little, together we can do so much. See you again in 15 minutes. We will have another oral presentation and also TUFH talks. Thank you for your attention. See ya. Goodbye.